I think that we're only, at least to my knowledge, we only come around this way once. I don't think we have a right to not give life, people, society all that we can, to give it our all, and to make use of everything we've been given to the fullest. And that's to our last dying breath. I think you just suit up, show up, and give it your best. There are 12 children in our family, 6 boys, 6 girls. Grew up in a small home with 3 bedrooms, with 1 bathroom for the 14 of us. I came from a very dysfunctional family. I'd love to say it was the 12 children Brady Bunch, but it wasn't. My dad, he had a big drinking problem, and so I grew up in a very strife-ridden home. I mean, I would go there at night to crawl into bed and sleep. It was a place to sleep. But I basically raised myself. I remember I was about 8 years old. Kids would have a bicycle with a box, a cooler freezer box in the front of their bike, and they carried popsicles and ice cream bars and things, and they had the little bell that they rang. And I ran to my mother to ask her for a nickel, and she didn't have a nickel to give me. And then it was a short time after that there was a single woman who was a widow that lived down the street from us. She needed some help to totally clean her yard, her gardens, her garden beds, and I worked there on a Saturday. I remember I started early in the morning, went till almost dark, and I worked really hard. And at the end of the day, and I didn't know how much I was going to get paid, she handed me a $5 bill. To not have a nickel one day, and a short time after putting in a hard day's work, I had a $5 bill. It just made a huge impression on me that you could really reap rewards and benefits through hard work. And then at 16, I must have met somebody who worked at Rockford Memorial, and they told me that there might be an opening in housekeeping, and so I went and applied, and I got the job in housekeeping at Rockford Memorial, and I was assigned to mop the emergency room department and the radiology department. So when I arrived at Mercy, it was a nice facility, but there were more square feet of facility than patients. And frankly, my second week on the job, the CFO came to me and said we didn't have enough cash to meet payroll. So Mercy basically had about 80,000 patient visits, no partner, meaning employed partner dedicated physicians on the medical staff, had less than 500 employees, and had about $33 million in gross revenue, but was losing money, okay, operating at a net operating loss. And I started bringing in new specialists and new doctors, and I started developing some outpatient doctor clinics in surrounding communities to bring specialty referrals in, and then continued to grow the new services and new clinics in the surrounding area, as well as new specialty services. And basically, at the time that we went to merge with Rockford Health System, we were close to $2 billion from $33 million in revenue. We had 1.6 million patients a year compared to 80,000. We had close to 4,500 employees, and we were in 70-some locations in both Wisconsin and Illinois. It's turned out to be an extremely powerful marriage between Mercy Health System, Rockford Health System, to become one legal entity called Mercyhealth. I expressed an interest because of my history at Rockford Memorial. I lived on the west side. I'd worked there. I'd gotten a scholarship from there to go to college. And we've added 250 new physicians. In the last 2 years, we've added beautiful new clinics. We've renovated some of the old clinics of Rockford Health System. We're obviously building the $500 million new regional special referral hospital in I-90 in Riverside. and we're putting $50 million to refurbish the old facilities on the Rockton campus. So I was driven by the desire, frankly, to improve the quality of care for the people of Rockford. After having spent 45 years in healthcare and having basically tremendously improved Mercyhealth system over the last 30 years, I feel privileged to be able to take all that we've developed at what was Legacy Mercyhealth system and use all those resources, financial, personnel, expertise, infrastructure, intellectual capital, and bring all that to bear to improve the hospital where I got my start at. It's very moving for me. I'm going to make use of this life and do all that I can to have an impact for those that I interact with and around me. It's always the long haul that counts. Suit up, show up, and do the next right thing every day.